Evening, everybody. Just going to try and see if I can get all the settings correct. So, okay, currently I have 3 people online and 4 likes. So that's pretty good going. I know that DC was going to pop over in a minute with the people on her stream. So that would be amazing if any of you do pop over. I'm just going to see if I can get the chat box up. Fortunately, I may have some technical difficulties. Hello, Root Row. Welcome. You're the first person. Hello, Amanda. Oh, and DC has joined with her live stream. So hello, everybody on DC's live stream that is popping over. I know we've already had some requests for different topics for me to talk about. So hi, Tatiana, Sarah, Kay Marie. Yep, you've been sent over by DC. Jen, Coconut. Wow. Feeling quite impressed now that I've definitely been raided. Helen, Tanya, Amy, Nikita. Right. Oh, excellent. Excellent. Thank you all for coming. So I am going to do my introductions. So I'm Eloise. I've been a UK pharmacist for over 20 years and I'm passionate about clear, accurate information that everyone can understand. And I want everyone to be able to understand their medicines and supplement and be able to self-care on a budget. So obviously I'm going to have to do my disclaimers. So my channel is for education and entertainment purposes only. I'm not your individual healthcare professional. So please make sure that you go to your own healthcare professional about your individual needs. Everything is my opinion, but I will do my best to make sure my information is evidence-based and up to date. And obviously be aware that I am in the UK, so I will be going on what the guidelines and legalities of things are in the UK, which I know quite a few of you, especially that have come over from DC's live, from the UK, from the US. So evening to those that are in the UK and lunchtime, afternoon for those of you that are in the US. Oh, you're all either lurking or loving the disclaimers. Yeah, Crystal, I have the same problem with redirects. It tells me that I'm redirecting, but then I still have to move myself over. Right. Oh, I think I'm going to have trouble keeping up with all of these. Yeah, so I have made a couple of people that from DC and a couple of others that I've noticed from live streams that are pretty good as a moderator. So in case we do end up with any spammers or inappropriate people, but I'm hoping that the majority of you that come over from DC's or have come to my channel are mature, sensible people that are not going to be doing anything inappropriate. Oh, okay. 10 a.m. on the West Coast. So, yeah, glad you're up early on a Sunday morning. 1 p.m. for the East Coast. Oh, yes. Yeah, Helen, you are right. Drug brand names differ. So when I say paracetamol, all my American friends all know it as acetaminophen. So, yes, might have to try and behave. Coconut, drinking your caffeine. I'm drinking my caffeine as well, but I think that's probably going to be one of the first topics of conversation is how do we get our caffeine into our system? Is there any need for caffeine enemas? So so the main reason for this live was to try and find subjects for future videos for you all, what sort of content that you would like. I've currently only got I've only got a couple of videos up at the moment. One about the HRT season ticket in the UK, and one about where I am as a pharmacist. But yes, I'm going to be doing a video that will be being uploaded tomorrow on iron supplements, because there has been a change in guidance around what the dosage of iron supplements should be. So that is going to be another one. So I am going to do a lot of information sort of about medicines, accurate information that people know, sort of side effects wise, adverse interactions and such like that. Yeah. So yeah, Rosie. So yeah, translate UK North American. Yeah. So I'm just going to DC, I'm ready to debunk all the nonsense. So that's one of the reasons why I decided to start this channel. Is unfortunately YouTube, TikTok, Insta is out there with the people that can grab people's attention straight away, and isn't necessarily correct information. It's not correct information that gets the Insta views. It's not correct information that gets the TikTok views. It's only out there information that is got there. Elaine, we do get called chemists. So yeah, quite a lot of people call us chemists, but yeah, technically the true name is pharmacist. My mum is actually a chemist, as in my mum has a chemistry degree, and she's an industrial chemist. She used to work for the steelworks, analysing all of the content of the raw materials and steel. But yeah, pharmacist means it's actually things that are going on in anything medication wise. All right, I'm loving all of these ideas that are in the chat. I'm not going to be able to keep quickly up today. But I will come back to this chat, and I will take down all the notes ready for future videos. So thanks, DC. It's quite overwhelming, this. So all of those that sort of want to look at other people on lives and go, the technical difficulties, it's a lot harder on this end. All right, so I'm going to just go through a couple of the ones that I've got wrote down. So iron supplement, caffeine enemas. I have shared at the very top. There's very little evidence for caffeine enemas. People did use them for constipation, as in, enemas work for constipation. If you've got a blockage in your colon of hard stools that is preventing flow through, putting an enema up there to cleanse it out does work. Doesn't actually have to be, it's not really much what the drug is or what the compound is. It is actually just the physical flushing. It's often been things that help. So phosphate enemas generally just are in there because it helps pull water into the stool, so it makes it softer to come out. Another one is the arachis oil, which is a softener you put in. It helps flush it out. So coffee enemas were put in there to help flush things out. So then you get all these people who want to detox. And so they detox the body quite often, literally by just taking in stuff that works as laxatives to flush throughout. And then they thought, we're flushing through from the top. Shall we flush through from the bottom? And the idea of caffeine enemas came to be, where they would put coffee in an enema. So get sort of like maybe half a litre or a litre of coffee, push it into the colon. It helps sort of loosen up all the stools that are in there, and it flushes back out. But as we were talking on DC's live, yes, caffeine will then get absorbed through, and it will irritate the lining. And so, it will work as a releasing constipation, releasing a blockage. but there is absolutely no evidence that it does anything else. It doesn't detox as such. All it does is remove feces, which feces are normal. They're in your intestines. They normally come out. That doesn't. Yeah, as you said, Sarah, you'd rather do a microlax, which again, it's just something to help flush out, which if you have constipation, you should be under a healthcare professional helping you do that. This isn't something that's needed. Yeah, Elaine, yeah, your body detox itself. If you've got kidneys that are functioning, they will get rid of certain soluble toxins out of your body. Your liver, it will break down other molecules that are toxins and then excretes them into your bowels and then out of your body. You even do excrete some things through your skin. Fortunately, one of the fun ones I always like to say that you excrete out of your skin is garlic. So it doesn't matter how you eat garlic, you're always going to stink of garlic because it actually gets excreted out of your skin. So yeah, even Rosie, even one kidney will do the job. So we do have to be nice to our kidneys and liver, but we don't actually need to be doing all this intense work to get them out. But unfortunately, I have, at the very, very beginning of this chat, I did put a link to a study about caffeine enemas, which there is some evidence that they help with constipation, because obviously it's the flushing, it's just the mechanical flush. You will get absorption of caffeine, so then any side effects that you get from caffeine, you'll get. Any benefits you get from caffeine, you will get. But it won't detox, it won't do anything. And unfortunately for the person that was promoting these caffeine enemas, one of the risks of caffeine enemas is actually damaging your intestines and your colon. By the physical force of pushing it in, you are likely to cause injury and rupture. And if you've already had surgery recently on your bowels and you've got scar tissue there, the last thing you want to be doing is risking anything that can rupture that scar. And that is my main concern with the promoting of the caffeine enemas in that particular situation. So hopefully that should answer quite a lot of the caffeine queries. When it comes on to colloidal silver, again, this is another one that winds me up. Is people taking a little tiny bit of knowledge and spreading it to a big issue. So silver, it's a metal, it's an element, and they found that, yeah, silver, bacterial cells do not like silver. It kills them. It's not natural. It's not for cells. So yeah, silver does kill bacteria. So we've impregnated silver into dressings for many years, impregnated silver into some ointments for many years, because if you've got an infected wound and you lay it on there, it will kill the bacteria. Unfortunately, silver doesn't differentiate. It attacks bad bacteria, it attacks good bacteria. So then we got onto people using colloidal silvers for things like acne. Yeah, great. It kills the bad bacteria, that the acne vulgaris bacteria, but it also kills the other good bacteria that are on your skin. And then people decided, oh, this colloidal silver that we've made for putting on our skin, when it's so great, it kills bacteria. It kills cancer cells in a petri dish. We'll take it internally. But it don't work like that. Silver just doesn't go and find certain cells to kill them. It just goes in your system. It also kills normal cells, because normal cells don't like silver. It's not supposed to be there. So these people that are taking silver internally are just causing problems. Unfortunately, once you've taken in silver internally, your body's not designed for excreting it. It's not natural in the environment to consume silver. Your body's never actually worked out a mechanism to excrete it. So as Rosie and a few other people have already said, it turns your skin a grey blue because it gets impregnated under your skin layers. It gets impregnated into your fat. It can also get impregnated into your kidneys and your liver because the kidneys and liver don't actually know how to excrete it. It goes there and cause problems. Yeah, Jen says it perfectly. It's indiscriminate to say chemotherapy or radiation. Yeah. Again, exactly, Helen. Like Trump with the bleach claim. Yeah, bleach kills COVID. Probably shouldn't say the C word and get kicked off. But yeah, but that doesn't mean that you can inject it in your veins and it'll kill what's going on without killing the rest of you. Yeah, we do need it. So I'm hoping that explains the colloidal silver. Also, really sort of, I find very, very confusing of the people that are promoting this colloidal silver are also the same people that have claimed that you need to detox your body from heavy metals. Yet there they are saying, here you are, take this heavy metal because this heavy metal is brilliant, but you need to detox from all these other heavy metals. So, yeah. Oh, yeah, coconut definitely blocks somebody who's wanting to spray hydrogen peroxide. Yeah, it kills everything. Unfortunately, probably kill you if you start doing that. So just going back to one of the questions that somebody asked very earlier on that I wrote down, which was metronidazole and alcohol. Now, this is one interaction that I'm always very concerned about. So I think the problem comes is that you get told antibiotics and alcohol, and everybody goes, oh, yeah, they say don't take it. So you get one extreme of people going, oh, I'm on my antibiotics, I can't drink alcohol. And then you get others going, but I've been on antibiotics and I took alcohol and nothing happened. But then there is this one antibiotic where taking alcohol with it is a problem. So generally, usual advice, if you're on an antibiotic, it usually means you're ill. Therefore, if you're ill, you probably shouldn't be drinking too much alcohol. You probably should be just making sure that you're resting, getting plenty of fluids and getting on okay and prioritizing your health. So I would advise against it, but there isn't, for the majority of antibiotics, there isn't really any interaction with alcohol. However, when it comes to metronidazole, which is a specific antibiotic, it's mainly used for anaerobic bacteria, which are ones that sort of, the bacteria like to fester without oxygen. So they're usually deep in your root canals, they're usually deep in your bowels, they're usually deep-seated infections. And metronidazole is used for that. But metronidazole does interact with alcohol. It prevents the way that alcohol is broken down, and it causes a really severe reaction. Basically increases your blood pressure, increases the blood flow up to your head. It will make you feel like your head is going to explode. Your whole of your head will be bright red, on fire. You will feel like you're going to explode. It is a definite no-no. So it is worth always double checking with interactions. What is the interaction and how serious is the interaction? Because I think some people go some thing and, you know, they listen to other people, and you need to make sure that you do know that one. So I'm hoping that has put some light on the metronidazole question. All right. Thank you, Tanya, for encouraging people to like. I would like the likes because it should help the YouTube algorithm. I'm just going to go see if I can work out looking at this. Oh, obsession with frankincense. I have no idea. Smells nice. That's my pharmacist opinion on it. Smells nice. I don't think it's got any medicinal benefit at all, and I definitely wouldn't take it internally. Is it? Yeah, heavy metals. Yeah. Why is one heavy metal worse than the others? In fact, well, the only heavy metal that you really need is iron, and it's only in small amounts for making your red blood cells. Right. So I'm sorry for my lack of technical ability. This is my first one. I am hoping that I can learn to be as good as all the others. Oh, which talk are we having a chat about pre-gabbling? Is this? I'm trying to look back to see what you are all taught. I'm going to have to ask. Yeah. So gabapentin and pre-gabbling. They are both very similar. Gabapentin has been on the market for decades. It works on GABA receptors, which are all over the place in the brain. And gabapentin was originally Neurontin was one of the brands. It was usually used for epilepsy. It was great for epilepsy, but as they used it for epilepsy, they also realised that it also helped with pain relief because GABA receptors are also involved in pain, especially in chronic pain where your brain signals are continually going through a cycle. Even when your body's signal to your brain is gone, you're still getting the cycle of neurons firing and telling you that they're on, that there's pain. And then they also found that gabapentin is great. It helps reduce general anxiety as well. So they use it for that. So company decided that they would see if they could try and make gabapentin work better, use that molecule, try and mend that molecule. And then they came out with pre-gabalin. So it's based on the gabapentin molecule, slightly different. And then they managed to get all the funding for all the research to do trials to show that it definitely worked on pain, definitely worked for general anxiety, as well as working for epilepsy. So they put it on the market at a massive price. And that was caused a big problem because although it was proven to be slightly better than gabapentin, it was a massive price. And doctors are like, yeah, but we've been using the gabapentin for work. We know. So we'll carry on with that. We can't afford to be using the pre-gabalin, especially here in the UK where it's the NHS that funds it. I can't talk as much about the US system, which is more of a if your insurance will pay for it or if you can afford to take it. And so there was a lot. Unfortunately, the GABA receptors are also very important for addiction and other sort of processes. So if you, and I probably shouldn't say this too much, but if you use gabapentin alongside your opioids, you can get in an abusive way, you can get a bigger abuse potential from them. And so that is why then they suddenly had to look and go, oh dear, people are buying the pre-gabalin, buying the gabapentin, and then selling them on the black market. And this is the reason why they ended up being controlled drugs, because both gabapentin and Lyrica have massive street value. So unfortunately, that has then made it very difficult for people who genuinely need it for pain and anxiety or even for epilepsy. To me, yeah. So as for whether gabapentin or pregabalin works better, unfortunately, it depends. And that's the problem. So for some people, gabapentin does work better. For some people, pregabalin does work better. If you were to get 1,000 people and put them in a trial, slightly more people would find pregabalin works better than gabapentane, but you don't know which group you're in until you start taking either or, which is why it still is the guidance to start with gabapentane, move on to pregabalin. As for the generics to the original brand Lyrica, for the majority of the branded generics that are available, they are identical. They're actually literally identical down to even all the excipients in it. Unfortunately, there was a time a few years ago when, because there was such a black market for these drugs, a whole load of actual brands, their batches got messed up. And people ended up getting batches of pregabalin brands that actually contained no pregabalin. And so they didn't work. And then that really did put down people's faith in the actual branded, the branded generic versions. So unfortunately, but yeah, there shouldn't be much difference between the brands and the jacks. Oh, yay, DC, I've got 1,000 subs. Yeah, pregabalin and gabapentane are both used in cats and dogs very, very effectively. Yeah. But again, with pregabalin and gabapentane, they are addictive, not as in as much you crave it, but as in the fact that your body has a feedback loop of your GABA receptors, and if you're having external pregabalin and gabapentane into your body, it modifies those, what your body actually produces in your brain. So then if you take the external factor away, your brain then suddenly isn't functioning correctly. The balance gets thrown off, and that's then what causes the anxiety and withdrawal. And so if ever you do need to increase or decrease the dosage of pregabalin and gabapentane, it needs to be done in a slow and controlled way. Yeah, exactly. Not that, Kate. If you forget a dose, you will feel that sort of withdrawal. So, right. Just, yeah. Okay. Yeah, it does. So, alcohol and opioids. Right. So, pregabalin and gabapentane are used for chronic pain, chronic anxiety. Opioids are used for chronic pain. Quite often they are used together. They do have an additive effect together. So yes, they have an additive effect for treating the pain. Unfortunately, they do have an additive effect of their side effects. And one of those side effects is called respiratory depression, as well as central nervous system depression. So it can make you feel drowsy, and sometimes the sleepiness is needed, sometimes it's not. But it also can affect your breathing, and it can slow your breathing. So for people who have problems with breathing, then that can be an issue. And that is the reason why you do have to be really careful with high doses of these drugs together, because that is quite often what happens in overdose. And there has been quite a few deaths, both of people taking them prescribed and for people taking them who has been abusing them. And then alcohol, again, alcohol is also a respiratory depressant and central nervous system depressant, and adds to that. As Breely has just said, benzodiazepines, they're another one that throw in the mix. If you end up with all three, a benzo, a gabapentinoid, an opioid, and alcohol, you end up with all four of them. Yeah, you've got to be really careful. It's a count of additive effects of all three drugs, and it's not 2 + 2 + 2 + 2 = 8. It's 2 + 2 + 2 + 2 equals about 20. So you've really got to be careful with that. So you have to be careful, but yeah, as Elaine, you've got to be careful, but that doesn't mean that you don't give it. It means that you have good conversations of making sure that things are taken safely. And with all of them, you can get what's known as tolerance. So because you're altering how your body chemicals are, your body gets used to that dose. And then that quite often means that you need to increase your dose to continually get the effect that you need. So sometimes you have to be sort of cruel to be kind, as in sometimes you actually have to sort of reduce the dose. Say when you're on a good time, reduce the dose so that then when you're in a flare, you can increase the dose and actually get that benefit when you need it in a flare. But it's difficult. And I can say this as a point of empathy of having chronic pain. A few of you probably already know I have Ehlers-Danlos syndrome. So all my joints dislocate randomly. So I've had my shoulder dislocate, my hip dislocate, and as of that, I've got damage, I've got chronic pain. So it sucks. And I know all the downsides for the medication. So I'm very much trying to find that balance myself. So it's hard to find it for myself. It's even harder for me to help somebody else find that level for themselves when they don't have the background knowledge and that they're having to rely on all the sources of information from everywhere else. Oh, those, naltrexone, low dose. Oh, yes, that's a very interesting one. Low dose naltrexone has been used for pain relief and chronic fatigue and such like. Very, very interesting, the mechanism for that and how you would think it's opposite to your opioids, but actually can provide the same benefit. It's because of the way that those opioid receptors in your body that are causing pain, it's the way it sort of gets in there. But yes. Oh, codeine and hives. Yes. Right. Yeah. Well, yeah. So, and yeah, it does suck, Rosie, for lupus, long COVID, MA, fibromyalgia. I understand it all. Yeah, hi, fellow zebra. If anybody wants to know what a zebra is, it's somebody that's got a rare condition. So it's a common thing when doctors are taught. It's when you look at a patient and you see a set of symptoms, always think horses, not zebras. Always think the most common thing, not a unique thing. But unfortunately, us people with rare conditions are zebras. We do have the rare condition, and we have to sort of say to the doctors, yeah, we are rare, we are special. And I am doing quite a lot of that education out to my local doctors and nurses that I work with. Yeah, it is rough, chucklehead, but got it. All I've got to say is I'm sure those zebras have this extra genetic condition that provides us with a very good sense of humour. So I don't know whether any other zebras can see that we've got a very good sense of humour, maybe slightly dark at times, but it keeps us going through when it's rough. So, okay. I was going to go about hives. Fortunately, any medication can cause hives. Any medication can cause an allergy, as in pretty much anything can cause an allergy. And you've got these people that say sort of there's good and bad things in life. There isn't. There's just good and bad things for individuals. So, yeah, people are allergic to shellfish. Doesn't mean that shellfish is bad. People are allergic to peanuts. Doesn't mean that peanuts are bad. There are your 12 food allergens that that probably cover 90% of the food allergies that people have. But unfortunately, people can be allergic to anything. Randomness ones, I'm sure my mum won't mind saying, but she's allergic to strawberries. They cause her hives. very random. Anybody can be allergic to anything. That doesn't mean that what's good for one person isn't good for another. Oh, leaves touching your skin cause. Well, again, Elaine, my mum, she knew she was allergic to strawberries, eating them. So she decided, well, I'll go strawberry picking with my mates. I won't eat any. Unfortunately, she still came out with hives because even just touching the leaves caused an issue. Yeah. So if you are allergic to something and it causes hives, then taking an antihistamine is the best thing to do. I think the brand names change depending on US and UK. But you've got loratadine and cetirizine are your once daily ones that are usually non-drowsy. And then you've got your chlorpheniramine, which is one that you can take 4 times a day, but it does cause drowsiness. Well, it does cause drowsiness in quite a few people. It doesn't cause drowsiness in everyone. And there is a 1% of people that get hyperactive on chlorpheniramine. And fortunately, that's usually the ADHD kid that somebody wants to try and put to sleep with the chlorpheniramine and finds out that actually they're climbing the walls all night. So quite often, my mum, when she went out, she was drinking some Pims and then found out that the Pims had strawberries floating in them. She then just had to take an antihistamine to counteract it. All I would say is that if you do have something that you've got an allergy to, just be always careful with that allergy. Allergies can develop. As you say, Sam, you're allergic to pineapple. One thing I would say about pineapple is, I'm allergic to pineapple. I eat pineapple, I get mouth ulcers. Even drinking something like Lilt, I don't know whether there's the equivalent drink in the US that's got a tiny bit of pineapple juice in it. Drink that and I still get ulcers. Pineapple, kiwi, and a few others are classed as what's known as latex fruits. If you were to Google latex fruit allergy, these are fruits that actually contain an enzyme that's very similar to latex. So you probably find that people who are allergic to pineapple and kiwi in such a way are also allergic to latex. And again, that is one of the allergies that can end up being a severe anaphylaxis allergy. So it's worth always keeping an eye on these sort of allergies. So, hoping you find that. Sam, so if you're allergic to pineapple and your daughter's allergic to kiwi, there may be some sort of link there. I don't know whether you said you were one of the zebras, but unfortunately, those people with Ehlers-Danlos syndrome also quite often have a lot of allergies and quite often can have something that's called mast cell activation syndrome, which is your immune system hates things and likes to cause you problems. I think is probably the easiest. Banana, strawberry, avocado. So all these people promoting all these detox smoothies, they're only any good if you actually can take them. It does, so pineapple does have an enzyme that can tenderize meats. I've never tried that. I'm probably going to avoid that. There is also the problem. I think there's a lot of information about allergies on there. When it comes to which is the best antihistamine, really, again, it's finding which antihistamine works for you. You've got cetirizine and loratadine are the two main ones that are over the counter. And in the studies, probably cetirizine worked slightly better for more people, and but loratadine was the one that caused the least drowsiness and side effects. That's with the dosage that you take over the counter. Sometimes if you go to a immunology specialist, they may decide to alter doses. But that is not something that I would recommend somebody do over the counter. Your chlorpheniramine, which is your drowsy one, definitely seems to work better when it seems to be skin conditions and skin irritation. And so if you do have it because it's actually contact dermatitis and contact eczema, then the Piriton can work better, as long as you're not going to end up being asleep all the time. There is fexofenadine. For a long time, everybody thought that fexofenadine was stronger because it's on prescription. Unfortunately, it's not any stronger. It does come in two strengths, a lower strength and a high strength. It is now available to buy over the counter in the UK. I have no idea about the US. The only reason why it has stayed on prescription for so long is because it has a known side effect of altering your heartbeat for what's known as the QT interval on your heartbeat on your ECG. And so it also interacts with a number of other medications that also lengthen the QT interval. And so that's the main reason why it's always been held on prescription, not because it's any stronger. There are a subset of people that find that fexofenadine works better than cetirizine or loratadine, and quite often, as we were talking about, preferential bias in DC's channel, those people that tend to have not responded well to cetirizine or loratadine end up going to their GP and then trying fexofenadine as a third agent, and then it works, and therefore everybody seems to think that fexofenadine works better. It doesn't. It just happens to have worked better for those people that the other two failed. There is still the majority of people where the cetirizine and the loratadine would work better, even if you did it the other way around. Yeah, exactly, Casey. It's just a matter of finding out which one works best for you, which one works best for your daughter. So, yeah. So, yeah, again, penicillin. Well, I wouldn't say that penicillin is a man-made chemical. Penicillin is a very, very natural chemical. Penicillin is found in the mold. I can't remember its name. And it was found that by taking that mold killed bacteria. So that's how it was developed, and using penicillin. But yeah, penicillin allergy is very real, but there is things of working out whether you actually have penicillin allergy or penicillin intolerance. A lot of people will say that the penicillin allergic when they're penicillin intolerant. So penicillin allergy, that is when you've taken the penicillin and you've come out with a rash, you've got swelling, you're struggling to breathe. That is penicillin allergy. And that is only a very small subset of people. And for those people, then they need to make sure that they don't have any derivative of penicillin, flucloxacillin, any of that group. And they possibly even need to be careful over some sort of similar drugs, even the cephalosporins. But a lot of people say that they're allergic to penicillin when actually they had side effects from penicillin, and they had the side effect of diarrhea from penicillin. Actually, that's not an allergy. Penicillin causes diarrhea because penicillin kills all the good and bad bacteria in your stomach and causes diarrhea. It's a side effect. Unfortunately, people say that they're allergic to penicillin because they've had the diarrhea and want to have something different. However, they'll take they'll be given another antibiotic, quite often erythromycin or clarithromycin is usually the alternative, and they actually cause even worse diarrhea. So it is always worth double checking when you have an allergy or a side effect to really give them details of the side effects or the allergy that you've had to your healthcare professionals, so that then they can modify how to use that. Oh, yes, K. Marie, there was that antihistamine. Oh, I can't remember the name for it. Yeah. Yeah, I do remember. It was used by lots of people. It was actually used in kids a lot, and then it got taken off. Oh, yeah, Sam. So yeah, projectile vomiting. Technically, we wouldn't say it's an allergy, but it is a severe enough side effect that you're not actually keeping it in your system. Therefore, you do need something different. And again, just because the antibiotic is given by injection into your bloodstream doesn't mean that it doesn't have side effects in your intestines, because your blood system does penetrate into your intestines, hence how the nutrients from your blood from your intestines get into your blood stream. And yet C. difficile is one of the big problems that we've got, that we're trying to make sure that people don't overuse antibiotics, because C. difficile is one of those bad bacteria that once you've got it, it causes major problems. So right, I am actually going to answer the levothyroxine question. I am actually going to touch on that tomorrow in my iron topic. So levothyroxine, it's based on it's the hormone T4 that goes around your body, made from your thyroid. And so basically you're taking it in tablet form to replace it if you've got either no thyroid or your thyroid's not producing much. So it is best to take it on an empty stomach. It gets absorbed better on an empty stomach, because that's just the thing. If you've got food in your stomach at the same time as it just doesn't disperse as well, and it just doesn't disperse into your bloodstream as well. So in an ideal world, it is best to take it before or after. Take it without any other food in your stomach. It's also best to take it without other medication, because some other medications can prevent thyroxine being absorbed. One in particular being iron. Iron does prevent thyroxine being absorbed. However, it's more important that you can actually take your thyroxine than not take your thyroxine. So if you can only remember to take your thyroxine with your breakfast, then it's okay to only take your thyroxine with your breakfast, because your thyroxine dosage is based on how you absorb and metabolize that thyroxine dose. So if you always take your thyroxine dose with your breakfast and you always absorb it at that rate with your breakfast, then your blood levels will alter to that. You will then show whether you need to increase the dose. And so you may end up with an increased dose. And then as long as you stay consistent with that, you'll be fine. So you may be on a slightly higher dose because you always take it with your breakfast. So my view with thyroxine is consistency is key. So whatever you do, keep it the same. 30 minutes before food, I would say. Probably 4 hours after food. It depends on what food you ate. If you ate a full, massive, high protein, high fat meal, then it's going to take 4 hours for you to digest. If you just had the light carbohydrate breakfast of cereal, then actually after about an hour your stomach's empty and you could take it, and you're basically taking it on an empty stomach. So the whole how long until your stomach's empty depends on how much and what you put in your stomach. Oh yes, adrenal. I've not got time to talk about that at the moment, but yes. So that so I could talk about sort of villainize antibiotics. Antibiotics are good and bad. If you've got a bacteria that is attacking your body in such a state that it's gonna cause significant problems, then you're going to need an antibiotic to get rid of it. And you do need to make sure that the doctor needs to really think about which is the most appropriate antibiotic. If you can test for which bacteria it is and go in there with a specific antibiotic to specifically kill that bacteria with the least side effects, the better. But sometimes you can't. Sometimes when you've got somebody that's just severely ill, possibly with sepsis, they're laid in a bed, you've just got to try and blast with the antibiotic to kill it and get over it, and then work out with supporting afterwards. So yeah, there is the overuse of antibiotics, but antibiotics are life-saving. So yeah, so yeah, we need to double check whether virus is getting that balance, making sure that they're not used when for the just in case that viral throat ends up with bacteria on it. Wait until you've actually got the bacteria on it, then you use the antibiotic. Use the shortest dose for the shortest amount of time to get on top of it. So, but yeah. Oh, so no, I was just going to say about the interactions with thyroxine and iron tomorrow in that one. Yeah. Oh, MRSA and vancomycin. Oh, yeah. Yeah. Vancomycin is brilliant for MRSA, but yeah, because it's so, because of the way it is, it does have side effects. Oh, yeah. Yeah. I'm hoping I'm pronouncing your name, Janina. Yeah, I have friends and family members that have had to have total thyroidectomies. One of due to due to thyroid cancer. So yeah, thyroxine is life saving in those situations. Yeah, and yeah. So sometimes, Sam, knowing when you get a cold that chest infection, some people are just prone to them, and sometimes you do need the antibiotics. And what you've got to hope is that other people aren't overusing them when they don't need it, so that the antibiotics stay working for when people do need it. Ginny, yeah. So that's the thing. Yeah, iron and everything. All of the body systems interact with each other. So yeah. Oh yeah, sinus infection. Yeah, Nikita. Yeah. I'm prone to sinus infections. Yeah, nothing ever goes on my chest. It always goes up. It's just the way that bacteria seems to know to go to the weakest point in you. So, oh, iodine. Oh, yeah, that one's. Iodine's a very tricky one to get the correct dose for treating anything. Yeah. So the super bugs, MRSA and C. difficile, they do scare people. They are still treatable at the moment. They are still treatable. There is still a good number of drugs that still treat both of them. So it's more of a matter of making sure people catch it early and get it diagnosed correctly. Right. So either in any of my videos, if you write in the comments, I'm still fairly new. So if you just in any of them, I will be keeping an eye on questions, or you can come over to me on Insta. I'm there as Eloise Pharmacist. DC's got me as a friend, as has quite a few people here. So you can look for me on there and send me a message on there. So yeah, Sam, asthma, that is, I am going to be doing, I've got that on my list of ideas to do something about asthma and being able to the different types of inhalers and help educate on the different types of inhalers in asthma. So what I'm planning to do is I still work as a pharmacist. So this is in my spare time. So I'm hoping to put up 2 videos a month. So once every 2 weeks, a long form video, although it won't be that long. It'll be only 10, 15 minutes. And then hopefully doing some short forms with information. And then I'm probably going to do a live once a month, probably on a Sunday about this time if it works good. Right. So where do I work? Now, that's an interesting one. I have no idea whether any of you in the US have anything similar. So I did do my basic grade and training in a hospital, and I have done work in a community pharmacy as well. But currently I actually work in what's called the Health Authority or Integrated Care Board. So I actually work for the GP practices in providing links between the GP practices and the hospitals in writing lots of different guidance. And I go out to GPs and nurses and provide training for the practice on all medication. So a lot of my work is either education of GPs, nurses, reception staff, the people that process the repeat prescriptions, and then also working with the consultants and the hospital, writing guidelines between hospital and primary care, so that people know when the drugs are started in secondary care, and then they're asking the GPs to take it on, who does which monitoring's done, where the prescriptions come from, everything like that. So very, very interesting. I also do a lot of data. So I actually analyze all the prescribing data for my group of GP practices to see what they're prescribing, whether it's in line with guidelines, whether it's the most cost effective, and medication management. So clinical. And I also, one of my most interesting jobs is I look after the millions of pounds that are spent on the high cost biological agents for gastroenterology and rheumatoid arthritis and such like. So that's very interesting. So anyway, I think I'm going to finish. I've been talking for an hour. Thank you so much. I have really enjoyed this. I am, they are amazing, Rosie. I love the biologicals. They are making so much difference. Thank you so much for everybody that's liked my stream. I've got 54, which is amazing. 37 of you were still on here. And I will be going from this, and I will be writing a list of things to do. Carry on after this live if you want to put any comments in comment sections with any questions, and I will try and answer as many as I can over the next couple of days. So thank you so much, and subscribe if you can, and look out for my future videos, and hopefully we can debunk some of this silly misinformation out there and actually help people get a balance of medicines are okay. You can use them, but we just need to use them sensibly. And don't read all the hype on supplements. You probably don't need them if they cost too much. So, thank you. Thank you, everybody. Yes, Rosie.